It's known to us, the bariatric surgeons, that whether it's a man or a woman, the hormones that have the sex drive, the estrogens in the case of a woman and testosterone in case of men, they're all depressed to pretty low levels, and they all are elevated after the surgery. So actually we've had several patients that have been caught into it that, well, I couldn't get pregnant before, and all of a sudden, how come, even though we have done that explaining before. So it does increase the fertility in men, sex drive in both the male and female. 18 to 24 months, we try to advise, please don't go and conceive. It could be hazardous to the child. You do need more nutrition and so forth. After that, your chance of having any abnormality and all that are just the same as you would have been otherwise. And that's why the advice is given that for the first 18 to 24 months, please use contraceptive for the sake of the baby, so that you can lower the chances of the abnormality. The sex drive, it also is half mental. So if you're depressed all the time, that's not going to work either. So it takes care of the depression also at the same time, along with the hormones. So all of that is a wonderful positive impact. Can you exercise? Not only that can you, but you absolutely need to. It is a part of the weight loss. The procedure in itself is going to help you consume less calories, but it's not going to be do it all. How soon? From day one, we get the patient up, or the person I should say, on the same day, not only for the exercise level, but for the prevention of the circulation, the blood clots, and so forth. And as you go, as you're comfortable, you keep adding more and more and more, from walking to whatever else you want to do. Well, the mom would be able to interact with at a not only active level, she'll be around longer to take care of them. She can go to the ballpark. She doesn't have to now have a wheelchair to take her to the soccer game that the child is playing for AYSO or something. All of these things, some of them you can put in words, and some of them you can't even put in the words. But basically, it's a day and night's difference. The diabetes is the most recent that has been in all the highlights. It's the type 2 diabetes, that's not the one we are born with, that has somewhere along the line come up, that the insulin producing cells have been slowly degrading. If you catch diabetes type 2 within 5 years of the diagnosis and have the gastric bypass, the rates for cure are 90%. And the other 10%, you will be taking much less medication. Hypertension is more weight related. If you lose weight, then 70 to 80% hypertension will go away. So it's a great thing to help those comorbidities that are related to the obesity. Morbid obesity is when we say that you now cannot fix it yourself and it is affecting your health, as opposed to just being a little overweight, but your life expectancy or the quality of your life is not affected. Whereas in the morbid obesity, all of these are affected. That's the basic concept of when I call somebody morbidly obese. What causes it? To some extent, we can have hormone problems, we can have endocrine issues, psychological issues, but I think to a great extent, it's a disease, in my opinion, of prosperity also. We're seeing it in every country. all of a sudden economic boom comes up and we are going in everywhere in our cars, we are drinking a little more beer, we are eating a little more, and less and less and less exercise. We don't even get up to switch the TV these days. I know, click, click, click. So all of these are the reasons for it. Complexity gets to a point that, then reaches a level that then we just totally lose control and you have to have help. The routine these days, some of it is even actually a requirement by the what do we call Medicare regulations. We have to follow them for a year at least. What I like to do is, if I can, follow for up to whatever their lifespan. First visit after the operation is 7 days down the line for your stitches. Then I see them once a month for a year. After that, every 3 months, 4 months, as long as they can come. Skin, unfortunately, is one organ that does not really have where we can build muscle for it. So depending on how much you're losing, and also depending on what is your view about your image, you're going to need plastic surgery or reconstructive surgery, whatever term we use. The excess skin, not only that it looks ugly, but it can also get to a point, depending on how much you lose, that there are folds, and the folds remain wet, and during the summertime they tend to get infections and so forth. So there's a pretty good chance that if you're losing a significant weight, you're going to need some sort of a procedure along the line. What I do advise is that have it done when you sort of reach somewhere near your dream weight, so you don't end up having two procedures along the way. So once you lose weight and you got excess skin could be on the arms, it could be on the thighs, it's most likely all the time is on the abdomen. These are called the abdominoplasty, that's the technical term, or layperson, it's a tummy tuck operation. But for the arms and all that, the leg, they're called different names. Usually a plastic surgeon does that. Sometime, as far as the tummy tuck, most of our surgeons have started to do it also, so you need to look into and explore that possibility. Even in this day and age, when we have known that it's a disease and we know that it's not under a patient control, but still there are some physicians who don't believe in it, and they still tend to think that exercise can solve all of this, or less eating and so forth. So you do have to be proactive. You do have to somewhere say, I've tried all of those. I've tried the dieting. The doctor recommended this, I've done all of those, or that I can't do. Then you have to be proactive. When we say the diets don't work, I don't mean to say that you can't lose weight. Problem with the diet is that you lose 50, then you go back, gain 60, then you lose another 50, gain another 60. So you're always like 10 positive. It's a yo-yo, up and down, up and down. And in that sense, the diets don't work. And that's why you have to then be proactive and go look for a surgical option. There is no absolute method set up. The rough guideline we use, that you have to be sexually mature and you have to be, as far as your bone growth and all that, fully mature from that. Brain, we know, develops a long time before that. The accepted ages on that one is 15 or so for the females and about 18 for boys. By 18, we pretty much know how tall we are going to be, and we are sexually mature. And same thing in the girls, by 15, they know how tall they're going to be, and they are sexually mature. And at that time, that's sort of the guideline that we all follow. And since the adolescent obesity is also up on the rise, so these do become important guidelines. One thing, I think, we like to be healthy all around. So in that regard, so yes, we need to be sexually mature also. Also, the other thing is that, one of the thing in even you take religious, you take medical, whichever term you take, one of the functions we are supposed to fulfill procreation. So either way you take, we would like to be healthy, whether we want to have any kids or not, but I certainly don't want to have some disease or something that if I would have delayed that procedure till I was sexually mature. The rough guide for a bypass is about 10% of your excess weight per month. And that sort of tells you that it's going to taper down. So if you use the example, I'm 100 pounds overweight. So first month, roughly 10 pounds. Second, well, now I have only 90 pounds left, so 9, and so forth. With the lap band, the weight loss is slower. It probably takes twice that much to lose. So if you have lap band, then you got to be patient and as far as the time frame is concerned. But that's a rough guide. And I don't tell my patients that you have to sort of take it as such a guideline that, well, if you didn't lose or lose too much, then that's a matter of concern, because men lose faster, women lose a little less, and everybody's individual, and there are some variations in that.